how often do we spend hundreds of dollars to seek healthcare professional recommendations? At AAMG YouTube channel, we bring our physicians and healthcare professionals to answer many questions of our viewers. Please remember to subscribe our channel so you will not miss any of the videos. My name is Esther, your host today on a very important topic, COVID-19 vaccine updates. I have invited our AAMG physician, internal medicine doctor. Her name is Angela Quang. Dr. Quang has been a frontline healthcare professional working inside the hospital last year, treating patients with COVID-19 in the hospital, meaning patients experiencing subacute or acute conditions. And I have the privilege to ask her about the treatment options as well as any precautions our viewers should learn when they have COVID-19. And she is also among many of the first-line healthcare workers receive the first dose of the Pfizer COVID-19 vaccine on the first day when it's issued. Let's ask her about all these questions people would like to ask. Welcome, Dr. Quang. I'm so honored to interview you at the end of the year in 2020. Were you able to introduce yourself to our viewers?
I'm Dr. Angela Quang, and I specialize in internal medicine. And I have been working, I had more than 20 years of experience in the internal medicine field. So I practicing since 1997. So until now, I have been working in the clinic and then in the hospital with direct patient care. And I'm still working with direct patient care until now.
Dr. Quang, how does the virus affect people?
Yes, since as you know, that the COVID-19 that started out, I believe that started in December of 2019, and it come from Wuhan in China, and it is spreading and become pandemic in March of 2000. Since then, we have the U.S. They have a shutdown quarantine for a while, a few months. Until now, the death rate is go up to more than 300,000 in U.S. And I have seen a lot of patients I come in. Up to now, a lot more come in. Every single day, we will get at least 5 COVID patients get admitted. And the virus is they attacking. First of all, they attack into your healthy cell. They use their spike protein, then they attack to the cell, attack to the receptor. They call the ACE receptor. And once that they get into the healthy cells, they're going to replicate. And more. And then when they replicate more, they take over the command of the healthy cell. And finally, the virus is going to kill the healthy cells and you become the infected. Now, when you get infected, that's a time that you get more symptoms because your body immune system try to fight that. So you're going to get the symptoms such as like fever, cough, shortness of breath is the top in there, and some then later on down the road there's more symptoms such as like headache, neck pain, body ache, fatigue, malaise. They also have some like cough, running nose, like some like a little bit more like flu symptoms also in there. And then the most important thing, that different than flu, that people will lose taste and smell, and they can develop some GI symptoms like abdominal pain, nausea, vomiting, and diarrhea. And A lot of people come in with that like high fever, poor oral intake, shortness of breath, and that's what we see more in the emergency room.
So you're treating the patient in hospital. So could you actually explain like what kind of treatment regimens you provide those patients with COVID, and how high the fever you have seen in hospital? Because we're outside and we haven't seen the chaotic inside the hospital. It's an honor to learn more.
Yeah, it's actually depends on case by cases. We don't admit everyone. When I say that at least 5 admissions, it doesn't mean only 5 COVID patients come in, it's more. So the benign and healthy, healthy doesn't mean they don't have any comorbidity. And even they have fever, some people I've seen that the fever go up to 39 or 39.5 degree. But if they don't have any signs of dehydration, that means they still can eat, they can drink. And they don't have like severe shortness of breath. Their oxygen saturation is good, like above 90. That's like, for the young people, like above 92. And those people, they just send home. They say that go quarantine yourself. Quarantine does mean like you have to isolate from yourself, from your family, and that. Some people, they can get the prescription for steroid called Dexamethasone, 6 milligram orally every day for between 5 to 10 days. And and other people with a severe affected, that's when they get dehydrated, they have shortness of breath, their oxygen saturation is low, we have to admit them to the hospital. And if their oxygen is low, you have to give IV, either IV or PO, oral. If they can take oral, you can give oral dexamethasone. If not, and give the IV. For me, I personally prefer to give IV because those people, they get sick, they have very poor oral intake. So I prefer to give IV dexamethasone. So that's the thing. And oxygen to support them. And also they order the supportive treatment, like if they have a lot of cough, give them some cough medicine, give them some IV fluid, not too much if they be dehydrated. So that is the first thing. And if the patient has more other comorbidity, like diabetes, COPD, asthma, heart condition, like dialysis on that, and that time that we have to evaluate to see if they need more medication. That's talking about the Remdesivir. And they have to be in isolation until they get better.
So Dr. Quang, were you able to explain to us, especially people with COPD or asthma or any lung function impairment patients, what could you explain to us under what condition you admit the patient regarding the oxygen saturation condition?
Okay, all right. So for the COPD and asthma, their lung capacity is not like normal, decrease already. Some patients with COPD, they are home oxygen. If they on home oxygen 2 liters on the time, and they get COVID, so they have to watch out. The oxygen demand might increase. That means like they were 2 liters. Normally they were 2 liters, their oxygen saturation is like 90. But now when they get COVID, they're wearing the same oxygen 2 liters, but their saturation is dropped to 88. Those are the alarming. That means the COVID affecting their lungs. So they have to seek medical attention, not just to turn on, like normally they will turn on the oxygen a little bit from 2 to 3 to 4. They can try that at home, but they call the doctor and see the doctor, either the doctor, or they go to, if they increase that For example, they use 2, they increase to 2 to 3 to 4, and their oxygen saturation is still 88, it's not going up, and they should go to see the doctor, either primary care or the emergency room. That's indicating that the COVID might affect in their lungs severely and make them to require more oxygen than that.
Mm-hmm. I see. So you also mentioned privately to me that the healthy individuals' oxygen level should be around 92 to 94 and above. But under exhaustion, if the patient have COVID, if they go for a walk and their oxygen will be dropped. So could you explain that portion again to viewer?
Right. So I have seen like patients they have COVID, and when they address, that means they're not doing anything, just sit there and talk to you. And we check their oxygen is good, 92, 93, 94. I say, okay, you don't need to have any oxygen, you can go home. And then we get them ready. And they say, okay, I'm happy that I'm going home. But then they get up and just a few steps, and you see that their oxygen drop. Some people, they drop from 92, 94, drop to the 85, 86. So those patients, I think we need to keep it to monitor, because you cannot just sit there, and you have to get up and do the daily activity. And level of the 85, 86 is dangerous to go home or functions on that level. And so we should get the patient, either give them oxygen so they can go home with that, or if they drop to the 85, 86, they should be in the hospital to get the steroid treatment until their oxygen get improved.
Mm-hmm. Mm-hmm. Yeah, sounds good. So in summary is that if the patient have lung impairment, if they found that their oxygen level has dropped, and also they increase using oxygen to maintain the normal oxygen level, they should still consult the doctor, right?
Yes.
So just in case. And then the second thing is that if they're healthy, but they're affected with COVID, and especially in the hospital, so you would assess them at rest and also assess them during exhaustion, like taking a walk, and see the oxygen have ever dropped to dangerous level. And by all time, the oxygen level should above 92 or 94 and above. Anything below, it could be a sign of not healing well, and they still need medical advice, right?
Yes, yes, they should, because sometimes the COPD patient, sometimes they just say, oh, my oxygen a little bit low, I just turn up a little bit. But if they have COVID, it's different picture. Yeah.
So you mentioned about the oxygen saturation. I think some people actually online, they have highlighted that it could be a severe symptom if your oxygen level saturation below like 90, right? Even 92 can be dangerous. So could you actually maybe, from your expertise, what is considered dangerous or suboptimal oxygen level, so for the viewers who are already using the oximetry to monitor, it would be give them a guideline in case they already have COVID.
So for those patients that we send home, we tell them if their symptoms get worse, if they feel that they have more shortness of breath, it just any time that they feel they have more shortness of breath, they should come back in. Get it at home, but not everyone have the oxygen, have the machine, the pulse ox to check their oxygen. So we just tell them that they come back in. And once if they come back in, we check that, just like say that if the oxygen drop, and then they will be admitted. Now, when the oxygen drop too low, that means it's probably the virus on the replicate and it feeds out in the lungs. So when the virus replicate, they feel the water, the debris, the water inside the lung. So you cannot exchange air properly. That's why that your oxygen saturation will drop. And that's why you have more shortness of breath, just like, if you in water, you suffocate us with that feeling. So that's why that you, at that point right there, that you need to get the treatment to support and supply the oxygen so they can perfuse the brain and the heart, all of that.
I see. So what is considered dangerous oxygen saturation in hospital?
We have like different kinds of the oxygen supplement in the hospital. So normal, you just have the tube connect to the oxygen machine, and that's they call that nasal cannula. It's the regular one, and it's up to like 10 liters or 15 liters. You know that they have the mask put in. They call that the facial mask or non-rebreather. It can go up to 15 liters. Once you get to that high, it's not good anymore. The patient can go into arrest really fast. So at that time that you will put on the high flow, that means the concentration is stronger, and it's up to the they call that the FiO2. I don't know. Yeah. The FiO2, if you go up to 60. When it goes up to like 45%, and there's alarm already, and those are people, there's potential they might need intubation. They might have to be watched closely. So I don't work in the ICU, and I work on the step down unit. So when we get to that high, we have to put in the maximum of high flow and see once the patient get that high, they're going to develop other symptoms like tachycardia, their heart rate will go up. They really get trouble breathing, you can see that. So if you go up more and if patient still struggling with the elevated heart rate, you can try some BiPAP. BiPAP machine with the mask in there is still strong, and they put the pressure into that mask to help the patient force the oxygen in there. And if they're not tolerating that, and the next step, like you have to get the ICU, transfer to ICU, and they will do the AAMG, the blood gas, to check for the oxygen level. And oxygen level, and decide if the patient needs intubation. Once the patient gets intubation, and they will continue with the Dexamethasone, the Decadron, and they will get the Remdesivir.
Quite complicated. Quite complicated. So how many patients can successfully recover without oxygen? Like have you seen patients recover from ICU?
From ICU, yes. I would go back in the beginning, like in March and April. So at that time, once the patient come in, they if they not get better, they deteriorating really rapid. You can see the oxygen drop from 90 to 85 in less than 1 minute. So there was a couple patients and get admitted, and I took care of both of them. One is become oxygen, require a lot of oxygen. So that patient, they end up, both of them end up transferred to ICU. One get intubated, and the other one just get better and get transferred back out under my care again. So in the ICU, she get intubated and stayed there for a long time, and they couldn't intubate her. So they did the tracheostomy. We get recovered stay in the hospital for over a month.
Wow.
Yeah, but subsequently that she recovered and she went home.
Oh, okay.
Yeah,
That's a good news. Yeah, yeah. Hopefully. So I'm curious. Do you think the virus affect specific race, or how's do you think the virus affect the race differently at all, or they treated everyone the same?
Well, at this point right now, we don't have a lot of data collections about race or sex on that. I cannot say specific. So it depends on the area.
Could you actually explain to the viewers how this virus hit the people with pre-existing conditions harder than the people without, such as people with diabetes, heart condition? Why affecting them so hard, and they tend to have more complications? What is the reason related to this?
Yeah, it's really important that most of the patients they admitted to the hospital, they have the precondition. They have, just like you said, diabetes, hypertension, asthma, COPD, or on dialysis, because those people, their immune system is low already, and the virus can affecting system in the body. The main thing they affect is the lung. So if the patient with the pre-existing COPD or asthma, their lung is not that strong. So when they get infected, their breathing, their oxygen will be low. Will drop more than healthy people. They can have when the oxygen's low, it can affect the brain functioning. Create the blood flow, the oxygen supply to the brain, and they can get confusion. Get oxygen decrease perfusion to the heart. And with the pre-existing coronary artery disease, they can easily get a heart attack because of the ischemic demand, and the heart harder, and they can get turn into the heart like that. So that's affecting the other people with the pre-existing condition.
I actually saw some information online mentioned that this virus caused the thickening of the blood. So and the treatment currently is using anticoagulant or even antiplatelet. Have you seen that treatment's been done in the hospital, or was that the same situation in the patient that you have seen in the hospital?
Yes, you're right. The virus that attacking the blood cells also, and it caused the just like you said, the thickening the blood, and they can develop pulmonary embolism. They can develop different thrombosis. So when the patient come in, they did a lot of the blood tests, and there is some blood marker in there. If the blood test called D-dimer is elevated, that when D-dimer is elevated, that's the indication that you might have your blood might have blood clot, or your blood is a little bit thick. So they will give the treatment, and normally they give Lovenox injection. The patient has an allergic reaction to that. So the normal for we call that DVT prophylaxis is 40 milligram. Depends on the kidney function. It's normal kidney function, the 40 milligram daily. With normal kidney function, and 30 milligrams for the kidney functions a little bit not at the normal range. So for the COVID patients, we increase and we treat that instead of once a day, we give the injection twice a day. And we give that they recommend that I've seen that here is for 30 days when you get the COVID. Yeah.
Oh, wow, I see. I also mentioned, could you actually tell us more about the actual treatments, medications? Because we heard some new medications that being studied or being issued. Have the hospital using the new medication or some new methods of treating the patients at all?
When in the first phase of the COVID, there's a lot of talking the hydrochloroquine.
Hydroxychloroquine, huh?
Yeah, Zifromax, all of that, and they say they don't use ibuprofen, it NSAID, and no ACE inhibitor. But there's no data is have been that affected. The only thing right now that I have seen that thing is the dexamethasone. That is for the lungs. If you get like hypoxemia, your oxygen level is low, so it's helping the lungs to get decrease the inflammation. And the Remdesivir, and that's the antiviral for the Ebola when they have Ebola and develop medication. So that's two that we're using. And I have seen only one case they use the plasma of the COVID patient. Not enough data to see that how effective it is with the plasma.
Oh, I see. So you mentioned about hydroxychloroquine. So did the hospital ever use that at all? Even
in the beginning,
they did.
Back in March, up to April or May, up to that time. Yes, I think May, and they stopped using it. They get an study come out and they say that okay, it's not working. Actually, do more harm. So I haven't seen them use that at all.
I see. So what are the key medication you be using lately for treating patients with COVID with severe symptoms?
Okay, with severe symptoms, we use dexamethasone.
Oh, I see.
That's the steroid.
I see.
6 milligram daily, either oral or IV for 5 to 10 days, depends on the symptoms. And Remdesivir. Normally, Remdesivir, they give like 200 milligram, the one-time dose, and the next day will be 100 milligram. And again, it can be vary between 5 to 10 days. Depends on the patient's condition improve or not.
I see.
Oxygen supplement and on of the symptomatic treatment like cough, fever, they give Tylenol. Yeah.
Oh wow, that's good. So Tylenol is actually better, right? It's even though you said it may not have enough evidence, but hospital tend to use Tylenol more than ibuprofen now.
Yes, we still use Tylenol. The ibuprofen itself, it can do harm to the kidney. So that's why we try to avoid that. And also ibuprofen, it can cause peptic ulcer, like bleeding in the stomach. So we try to avoid that.
I see. That's good. So yeah, I my family tend to use Tylenol. Tylenol is it's more mild, right? More mild than ibuprofen. So could you actually give us some advice to our viewers how they should best protect themselves to prevent infection with COVID? Because more and more people now have infection from this virus. So I think the number I heard is depends on which area you live. Some is 1 in 40, or some places 1 in 14. So depends on the county. So the number is actually greater and greater every day.
Yeah. So the disease, the disease still going on, still spreading. Fortunately, that we have the vaccine come out, and the first day that you get the vaccine, December 14. And I get it. So I get the vaccine on the 14th. So the vaccine is 2 shots, not 1. So you get the first one, and the second one is the booster 21 days later, but they give you the range. It'll be between like 19 to 23 days. So that time period that you can come in to get the booster. Now, when you get the first shot, you will get about 50 to 55% immunity after 1 week. And when you get the second one, the booster, you will go up to 95%. So that's good that if you get that, but that one is going to protect yourself only when you get the vaccine. Protect yourself, not other people. So we have been doing that. We still have to use mask and 6 feet apart, and sanitizer, washing your hand, everything, and that. And that is the effective way to prevent spread of the COVID, the virus, and that.
Oh wow, that's good to know. So since you're actually the person who already gotten the COVID vaccine, the question was really asking, is it safe? I guess you already think it's safe, right? Otherwise you would not put yourself in an unsafe condition. But still, people still wanted to know how safe it is, and do you even recommend people get it, or do you want everyone should get the vaccine? Can you actually, I want to hear from you, even though you already gotten it.
It's really safe. And just like I say that if you give you the immunity, you get the virus, get infected in there. The studies, there is some minimal side effect on that, no severe. So it's safe to get that, and it's good to get that. But unfortunately, they have very limited amounts right now from Pfizer. The other company, I think Moderna, is going to come in a few weeks. So we'll have more on that. Right now, they just give it to the healthcare provider, the frontline, and the adolescents in the nursing home. But hopefully, later on, you can get that to everyone. And it's really safe. And if you don't have any history of allergic reaction to vaccine, I think you should get that.
Yeah, I heard that it has caused some reactions, especially on the second dose, and they recommend like taking 1 day off in case you have fever. Are you taking the day off on the second dose of vaccine injection?
It's hard to say that now, but my booster, the second one, that would be the last day that I work. So I don't have to take it again. I'm off the next day anyway. And that's not because I want that. It's just because you have to get like 21 days after the first one. Happened like my last day of working on that day. And the next day is a 21 day. So
that's perfect for you. You can rest a few days. So I think some people are still want to ask, after the vaccination, do you think people will still need to wear the mask and still keep the social distance? What do you think?
Yes, absolutely. Just like I said that the vaccine is a protect yourself. If you get that, protect you. I get that, protect me. But it's not protecting other people in there. So the vaccine, you still can get infected. It's really, really very, very tiny percent that you will get that. So if you get that, and you can spread that to other people. So other people, they still have to wear masks. They still have to have the 6 feet apart in order to stop the virus spread. So if you get the vaccine, we still have to do that in order to stop. And I hope that the pandemic will stop by next summer.
Yeah, we hope so. So yeah, thank you so much for the advice, and Dr. Quang. So I think you have very valuable insights and a suggestion to the viewer. Do you have any final comments and suggestion to the audience during this pandemic?
Again, have to be safe, wearing masks, 6 feet distance, and sanitizer is not touching anything and then touching your eyes, your nose, and your mouth, and that. Wash your hand every time you do something. And we'll keep everyone safe by that. And hopefully everyone will get the vaccine and the endemic soon.
Fantastic. Yeah, I hope everyone stays safe. Thank you so much, Dr. Quang, for advising the people who already have problems, already chronically ill and compounding with COVID disease. It could be more dangerous. So please seek help. Call your doctor or call emergency room if you need it. Thank you so much for watching, and please share this video to your friends and family. Thank you. Thank you, Dr. Quang, for answering the question.